My practice consists of primarily of patients with illness or deformity or pathology pertaining to the foot, ankle, knee, leg, and some soft tissue up to the hip. I'm also board certified in wound care, so patients with wounds such as diabetic wounds or pressure wounds I can address as well. Typical things that we see in podiatry: ingrown toenails, bunions, hammer toes, heel spurs, but also skin conditions like athlete's foot or other fungal conditions. A lot of things that go wrong with the body can be identified first in the foot or leg, or if there are any biomechanical issues that start out as a small problem in the foot, by the time they reach the higher levels of the body can become magnified. So that in biomechanical instances, if proper correction is made at the level of the foot, you can get relief up as high as the neck. Diabetic screenings include tests mainly for feeling. We test for light touch, we test for vibratory sensation, we test for sharp and dull sensation. And so besides the physical hands-on testing, we can test for hemoglobin A1C in the clinic as soon as the patient comes in, and we can get basically a snapshot of how their blood sugar has been in the last month and get an idea if their blood sugar is under control. So those are two of the main things for diabetic testing. There are any number of screening things for testing range of motion, testing patient strength and mobility. Important for everybody to know that their feet are working the way that they're supposed to. For certain patients like diabetics, it's extremely important, because if they start to have issues with their sensation in their feet, that can lead to problems immediately in the short term and in the long term, with injury, with infection, with ability to be able to walk properly. Very important for diabetics. For people who have less pressing issues, still important if they have any type of history of joint problems, any type of muscle problems, and as we have mentioned before, things like heel spurs, even people with arthritis can benefit from regular visits to a podiatrist. First time in my practice that I've been able to work in a multi-specialty arena. When I was in my residency, obviously you had the resources of an entire hospital at your disposal. It's very similar to that because we have different practitioners from different specialties, a lot of support from lab and other diagnostic testing equipment that we have. And what's great about that is it's great for the practitioner because you have the ability to get instant feedback or provide instant input for the other practitioners in regard to your patient, and without having to worry about calling anybody or getting in touch with another doctor's office and trying to reach another physician.